Good afternoon, residents, team members, families, Pinnacle Advantage members. We appreciate you all tuning in. Those of you that are tuning in live here on September 8th. Those of you that are watching tonight, thank you for taking time away from your family life, especially residents of the Jewish faith. Happy New Year. If you're taking time away from your family and other celebrations to listen to this information, we just want to say thank you. Secondly, just want to start off with an apology. I think apologies are underrated in today's world, so I just want to apologize to the community at large here, residents primarily and families of residents that live here. I think we had a phone outage, something about a phone outage here over the last few days. We were without phones for 25 hours. This one was a little complicated because it was two organizations that had some issues outside of Cedar Field to fix, and then come inside our property to amend what they needed to do here. So when you have Verizon and Dominion Energy trying to work collaboratively, it proves to take a little bit of time. So we did learn lessons through this outage. Mainly, I'm going to explore options within the cellular world, within Verizon, within that organization, of how we can see if there's anything different that from the language that's in our current contract that can escalate an outage at the community even higher than when we first signed the contract, given the fact that we serve a very specific population and that safety is paramount of the people who live here. And so we signed that contract a couple of years ago, so I am going on a little path here in the next week or so. I've already made the phone calls within our current contact at Verizon to see if there's anything different that we can do in terms of escalation. So the other two things I've learned about the phone outage is how do we communicate with people when we don't have phones? Not everyone has a cellular phone. Some folks have chosen just to use the Cedar Field phone line. And so what do we do when there's a phone outage? Hopefully many of you were tuning into Touchdown and seeing different updates. We updated the screen 3 times over that 24-hour period of time, would be one. 2 other things I think we could do better, I can do better. One is have a database of family members and their phone numbers. So when we do have a phone outage here locally, we can still get in contact with families and blitz out a message to everybody simultaneously. So we're working on that. More to come about that in the next couple of weeks, about how we're going to gather a database of family phone numbers, particularly those families that have a loved one living in healthcare, assisted living, or our memory support area. The second thing I learned that we could do better is a resident email address database. And so that's the other thing I will be updating residents about in the next couple of weeks, is how can we maintain a very accurate database of resident emails so that we can communicate to residents, those that have an email, be able to communicate that way. So between using our Touchdown account, which is an in-house television, for those of you that are viewing this that aren't aware of what Touchdown is, our in-house channel so people can view messaging on television, between blitzing out messages to the family members via their own cellular phone, utilizing email addresses a little bit more. I think we've learned lessons here and we'll be more prepared the next time. So in terms of our, I'm going to shift gears to COVID-19, our dashboard. Do we have anything current? Nope. Ann, do you have anything current?
Oh.
We have one? Or no, that cycled off? Yes. Okay, so our dashboard, sorry, I was getting real-time information here. Our dashboard at Cedar Field right now is green. We have 0 residents and or team members that have any cases. Can I get an amen? Amen. Amen. So we're going to keep it that way throughout the winter. So that's all good news. In terms of the regional dashboard, the 7-day positivity rate, just had a chance to look at that a few minutes ago. The state positivity rate went down a couple of tenths of a point to 10%. Henrico County ticked up a little bit from 9.1 to 9.3. And the city of Richmond ticked up almost 1 percentage point from 12.7 to 13.5. So that's the positivity rate. Children are back to school, so keep everything crossed as of today in Henrico County that our teachers, our superintendents, and most importantly, our children are safe getting back to school. And maybe a little arrow prayer that all of those that the school board have put together some nice solid protocols to deal with the variety of issues that may be coming at them, like we did back in 2019 before we all got vaccinated. So in terms of our COVID-19 evolving preparedness plan, I really don't have any new news with our Cedar Field Forward plan. The copy that you currently have on your coffee table, I know everybody has this plan always readily available out on their coffee table. That plan has not changed from 2 weeks ago. Although I do want to make another push. We do have a mandate of mask wearing, and we have seen a significant number, especially over this holiday weekend, a significant number of visitors coming to the campus that arrive at the gatehouse that don't have a mask or aren't aware of the mask mandate. So if we can give another push this weekend, if you have somebody visiting the community, residents or team members, if you have people coming to visit, make sure that they if we all can remind people as they're coming to Cedar Field that there is a mask mandate. In terms of the vaccination mandate, we have made David Stewart in dining services and the team, and Matt Dameron and Tamika Ross leading the health services team, 2 of the largest areas, have made some significant improvement over the last week. You may have recalled about a month ago, I reported that there were 62 team members that were unvaccinated, and it was highly likely that half of those folks would probably be leaving us due to the vaccine mandate. As of just about a half hour ago, a new list came out, and it looks like that number is down to 11 people who may just be leaving us because of the work of the team, helping people at the very last second. Persistence is paying off. Don't say no until the very end, and educating team members about the value of this vaccine. So next Monday is our deadline, and let's hope that 11 stays true through next week. Just want to clear one thing up. I hope I'm not taking the thunder from Dr. Scheer and Ann Hopper, because they will be up here in a minute. I want to clear something up about booster versus third dose. Those 2 terms are intertwined at Cedar Field. As I, over the last kind of 10 days, as I've been fielding questions in the hallway and or email or telephone. Michael, when are we getting our third dose? When are we getting our booster? Those 2 terms, in the eyes of the pharmaceutical world, are not the same. So, what is the definition of a booster, and what is the definition of a third dose? The booster availability is still subject to the approval of the FDA and the CDC's advisory committee. So what is currently approved is the third dose, which means the Pfizer or the Moderna vaccine for significantly immune compromised individuals that meet a very specific criteria outlined by the CDC. So a third dose is approved for those individuals. If you need a list of that criteria, Ann Hopper and Dr. Scheer have a list in the wellness clinic, and or the clinical leaders in the 5 neighborhoods and health services has that very specific criteria. In terms of a booster shot that we all may need, we don't know for sure whether we do need that booster shot. So Ann and Dr. Scheer can talk a little bit more about that. We are working, it is highly unlikely that we will be partnering again with Walgreens or CVS. We have not received any indication that those two entities are signing a contract with the federal government to go through that mass mandate or that mass rollout again. So what is Cedarfield doing? We are partnering with Remedy Pharmacy that we have here locally downstairs on the 2nd floor, and we use in the health services area, quite honestly. We are working with them to attain and procure the, not procure, but attain the booster shot for when that gets approved by the federal government later on this month. So be rest assured that the team here is working with Remedy. If you are one that just has a little bit of reservation or panic about going out to the marketplace and going to a retail shop of getting this particular booster shot when it gets approved, we are going to work as diligently as we can with our current pharmacy provider to have a series of clinics right here at Cedarfield. So, and given the feedback from the residents and the families and team members from the first clinic, or first 6 clinics, we actually had 6 clinics, we will work as hard as we can to make them as smooth as they were back in February and March. I'm going to post tomorrow a memo from Remedy Pharmacy management team. They've posted, we've asked them to create a memo about the last 5 minutes of discussion here so that you can have this again on your coffee table and refer to it. So look forward to this posted on Touchdown tomorrow, this memo from Remedy, and we'll get it into the residents' cubby boxes and mailboxes across all levels of care by tomorrow at 5 o'clock. Okay, so we have a little bit of, we have 5 people here to present today. We have Dr. Scheer and Ann Hopper with some news from the clinic. We have the Reverend Florence Brooks for some updates from wellness and lifestyles. We have Matt Dameron here to talk, our Associate Executive Director, to talk about some information from the health services side. Jack Johnson from maintenance has a little bit of information that he would like to impart, and David Stewart, our dining director, has some information about dining services. And then I'll come back, got a few little tidbits from the administration suite, and then we'll round out this hour with some spiritual well-being. So I'm going to call up, let's talk food first. David Stewart is here to talk a little bit update about dining services.
Good afternoon, everybody. I'm David Stewart, representing Dining Services, and I've got a couple of important announcements for you. One is great news and one is just news. The great news is that we are going to reopen the Atrium Cafe next week in a very limited fashion, but nonetheless we are going to open it. The great news is we've hired a supervisor who will be in charge of the cafe, and we are working to build that team back up. So our programming next week will be very limited choices, and basically it'll be a two-person crew down there. So the two people will be doing what they can. We plan on having a couple sandwiches, a couple scoop and go hot entrees from the dining room, a couple of salads. We're going to start with dinner service, 3:30 till 7, Monday through Friday, and we'll see if the team can keep up. We're planning it that they can, and it'll be great to have some service on that side of the building again. And the new person anchoring that, you're going to enjoy her very much. Her name is Tanika Sellers. She's a very sweet person. She comes to us as a recommendation, somebody that Chef Tyrone used to work with, and we're very thrilled to have her. So swing by, introduce yourself to her, and we'll see if we can grow that service back up. So there'll be more published on in your cubbies and on our dining services channel as soon as we put all those details together, but we're shooting for next Tuesday, and we're down there right now having our equipment people check everything out, getting things restocked, getting ready for that. The other news is just plain recruitment. Labor Day sees a lot of activities in people's lives, with kids going back to school and things like that. So while one of the incentives that has been floating out for unemployed people went away, that hasn't yet generated a lot of volume with applicants, but that's typical around Labor Day. A lot of people vacation, kids going back to school, things like that. I happened to see the CEO of ZipRecruiter on television yesterday, and he was talking about they had a 0.2 increase in activity as a result of the one government incentive going away for unemployed individuals. So nothing too much yet, but I will say we've been doing very, very well with getting applicants and screening them. I know some of you people who come to the dining room have met some of our new people. They're delightful. They're very great people to have around, and we'll keep working to build the roles back up. But very, very good news. We're as thrilled as anybody to try to get some kind of service back in the cafe. So look forward to an announcement on that. And in that, we have a number of people here who are going to speak. I'll leave it at that. If you have any questions, reach out to us. Yes?
I've not been able to receive 973 channel for some time, and there are other people in the building who haven't too. Do you know what's going on with that?
The question is that an individual in the audience here has not been able to see 973 for a while. I hadn't heard that, but I will certainly reach out and see if I can figure anything out about that. It's a good question. Very important to receive dining updates about what's going on. So thank you for that question, and I'll check into that. Great. So thank you for your time. Thank you, Michael. Good to see you.
While Florence Brooks comes up to the podium, there was a question that came in about mask wearing. And is it okay not to wear a mask in the activity room? While we're playing pool, can we not wear a mask? Can we not wear a mask when we're walking 25 feet between A wing and B wing? So why don't we be a little more clear about mask mandating? When a resident is not in their apartment or cottage walking around the community, aside from being outside, everyone needs to wear their mask. Whether we're playing cards, whether we're in the restaurant and we're not happening to be eating, we need to wear a mask. Whether we're in the hallway, mask wearing is mandated when we're in a public setting, aside from being outside and or in eating. So hopefully that clears things up. If anybody has any questions about that, And that holds true for team members as well. Team members who are working in this main building, if they're not on break eating, they need to be wearing, this includes me too, we need all to be wearing a mask. So.
Hello, I'm Florence Brooks, Director of Lifestyles and Wellness. I wanted to share with you that we were delighted to have 90 residents at the Labor Day Social this past Monday, and the Liberty Dolls were a big hit, and we hope to have them back during the holidays. You should have received a flyer in your mailbox about a 9/11 remembrance that will take place this weekend on Saturday morning. I did want to bring you up to date on a few staffing changes in Lifestyles and Wellness. Many of you know our Cedarfield concierge, Ann Reed. Ann joined the Cedarfield team in March of 2017, and she has provided a variety of support for Cedarfield shopping during the pandemic. She's a history buff and has provided some tours, and of course works the desk in the evening. Ann is retiring as of tomorrow and is planning to relocate. So if you haven't had a chance to do so, please thank Ann for her service to Cedarfield. She's been a real asset to us since she joined us in 2017. Perhaps you've met Kimberly Fricky. She's new to the concierge desk on the daytime shift and works as a sub. You'll be meeting in the next week or so Elaine Manktalo, who will be working the concierge desk on Sunday through Thursday evenings. Please be sure to welcome Elaine. And then one last update is Mariah Robinson, who many of you know through Helping Hands, has been promoted to the administrative assistant position in Lifestyles and Wellness. This transition will take place over the next several weeks. So we're real excited about the changes taking place, and above all, we really wish the very best to Ann Reed and are thankful for her time here at Cedarfield. Thank you.
Hello everyone, I'm Jack from Maintenance, Assistant Director of Maintenance and Engineering. Just have a couple of quick updates to share. Last month I mentioned our active shooter notification system. We talked a little bit about that. Over the past few weeks we've reviewed the system and made some improvements to it with the assistance of the Henrico County Police Department. And we will be conducting the test, the actual test, where we, have everybody dressed up like an active shooter and that kind of thing to run through in the next couple of weeks. So we will have a handout with some information about everything. We'll give information about the 4 A's of the active shooter response. And we'll have that in the mailboxes by Friday. So that'll be a good one to have on the coffee table with the other information that Michael was talking about a minute ago. The second thing was we are planning and have set up a plumbing water shutdown next Wednesday is what we're setting up for. So we have a couple of leaks on the independent side of the building on the second floor that will require us to shut down the domestic water supply during the night hours. Should start around 9 p.m. and run till about 6 a.m. It's pretty substantial repairs that will require shutting it off and draining the system down to make the repairs. But we've been working with contractor assistance to make sure that we have enough people, on hand to get this all done during that time frame to minimize how long the water system is down. So Michael and I will send out a phone reminder next week in advance to let everybody know that we are going forward with that, and it should go pretty smoothly. And that's really all I have for today. Thank you all.
Good afternoon, everyone. My name is Matt Dameron, and I serve as the Associate Executive Director here at Cedar Field. Just 3 quick updates for you. The first one is about some new faces in our Health Services Department that are going to round out our neighborhood and household leadership team. So we've had a few vacancies for a little while, but with these 2 new additions, we are full with all of our clinical and household leaders. So the first one is Leticia Hayes. She is an LPN, a licensed practical nurse, that started with us 2 weeks ago. And she is working she is the clinical leader of our Magnolia Meadow household in healthcare. So she will be co-leaders with CJ Adcock, who's been with us for a while now. So Leticia started out as a CNA and worked her way up to becoming an LPN, and she's been an LPN for 6 years now. So we're excited to have her. And then as of today, in orientation today, is George Lawson. He is also a licensed practical nurse. He will be the clinical leader in our Lavender Lane household, and will be co-leaders with Katie Zilkowski, who has been with us for a while now as well. So like Leticia, he was also a CNA and worked his way through nursing school and became an LPN, and has been an LPN for the last 4 years. So we are excited to have these 2 people. Our director of nursing, Tamika Ross, worked with these 2 people very closely at her last employer. So we know their work quality, and they're used to kind of a high-paced environment. So we're very happy to have them here with us. We also have a couple, just along those lines, a couple of new nurses and CNAs that are in orientation this week that will be joining our health services team in the neighborhoods and households. The second thing is our assisted living areas. So Garden Grove and Morning Glory Avenue are gearing up for our annual inspection survey, which is through our Virginia Department of Social Services, or DSS. Every year they come in, and it's typically towards the end of September. It's unannounced, so we don't know exactly when, but they will be coming in around that time to essentially inspect our practices and make sure that they are up to the current state regulations. So they'll be coming in and doing interviews with team members and residents, observing medication passes and treatments, looking through policies and procedures. So I look forward to kind of giving you a little rundown of those results when that survey comes, probably here in the next couple of weeks. And then the last thing I'll mention is just kind of a friendly reminder. We do have visitors coming into all 5 neighborhoods and households in health services. Just a reminder, we really want to make sure that you're wearing your mask, especially families that are coming in from the outside, and try to stay in the resident apartment when you're conducting your visit, or outside. The weather's been really nice lately. Outside on the screened-in porch area, or in one of our visitation vistas, but not out in the common area with other residents. All right, that's all I have. Thank you all.
Hello. Okay, Dr. Shear, can I get the flu vaccine the same time that I get the COVID? 3rd shot, booster?
So this was one of the questions that we'd had a few weeks ago, went back and looked it up. You are able to get both vaccines at the same time. There's no contraindication to that. However, I would say, as we all know, getting any vaccine, you can have some cough, congestion, fevers, kind of as you're mounting that antibody response from any vaccine. So I don't typically try to give too many at the same time. And I've been recommending that if you have, the ability to try and space it out a week or two, you'll probably feel better. So it's not necessarily medically necessary. You could get both at the same time if you chose to, but I would say if you have the ability to space it out, you'll probably feel better doing so.
Someone is positive and I'm around that person. What do I do?
So if you find out that somebody is positive that you've been around, you want to make sure that you're either reaching out to the clinic, to Ann yourself, or to, if it's a staff or team member or contractor, that we're reaching out to Connie, who's our infectious disease nurse, to inform them. We would, anybody, since you have had, if it's a known positive, that means that you have now been exposed to a positive individual. So we're going to be testing you, and then watching you very closely for symptoms as well. So I think we've kind of explained that in some past talks, but we test with a rapid and then follow up with a PCR tested. But we just want to make sure that everyone's vaccinated that can possibly be vaccinated. That's why we have our initiatives here. So although you're still not at a high risk of getting it, there is some, like we said, those outbreak cases, and so that's why we do go ahead and recommend that we test you. Mm-hmm.
So this is to piggyback off of Michael. When are we getting a booster versus this third dose?
So right now what we're telling everyone is if you feel that you are immunocompromised or you meet the criteria for a third dose, those are currently available right now at places like Walgreens or CVS. So you can go in and they have a little questionnaire that you fill out showing that you're immunocompromised, and they give you the shot right then. It's usually not, from what I've heard, it's very quick and easy, so not very complicated. So that would be for your third dose. So far as the booster, it is not quite yet FDA approved, but I do hear that that's going to be as soon as September 20th on the last lecture I listened to, so I think it'll be very soon. We'll probably all find out at the same time on the evening news. So I do think that it's going to be approved here fairly soon. It is kind of, the recommendation has been 8 months from your last vaccination. So for everyone here, it still wouldn't even be recommended for any of our residents until, around that October time period. So I don't think that, and I think, as Michael said, we'll hear from Remedy, kind of the plans to dispense that booster, whether it be here or if we're sending people out that are independent. I'm not sure how that all will work, but we'll be hearing more from Remedy on that. But again, we wouldn't even really be eligible for it till sometime in October.
So are you saying that we have a flu season, but we don't have a COVID season yet?
Yes. So, and I think that this more has to do with, again, it reaches back to kind of the positivity rate of the community that we're in. If we were in a perfect world where we all stayed away from each other, 6 feet distance for, a 14-day time period, and got our positivity rate or our incidence down very low, we probably would result in more of a seasonal kind of the way you see the flu. But right now we're seeing COVID year-round, and we're seeing outbreaks year-round, more centered around when there's groups of people. So, we kind of saw a spike after Thanksgiving, we saw a spike after Christmas, we saw a spike after 4th of July, and that makes sense because that's when we're getting together in large groups. And that's why we're seeing, and then the variants as they come through worldwide. I do think that, maybe a few years from now we may see, once yearly booster shots are vaccines for COVID. But right now, we're not there yet. The prevalence is still too high to be able to relax and say, we'll wait till next year.
Can we get Moderna if we've had Pfizer first?
So I'm not 100% on the answer to that. I know the last time I listened to a lecture on it, it did recommend that if you had gotten Pfizer, that your booster shot be Pfizer, or your third vaccine be Pfizer. There's not, I do know of cases where somebody has gotten Pfizer for the first shot, Moderna for the second shot, and they said you can get either one. But that's more probably an error that occurred than the norm. So I do know that typically when they are asking you for your booster or for your third shot, they're giving you the same one that you had before. So I think that's the recommendation, but I'm not sure if there's, strict reasoning behind that, strict medical evidence, or if they even have those studies out there really yet.
Are there different treatment options if I test positive with this breakthrough now?
So that's kind of an interesting question, because I think way back in the beginning, we were kind of looking at anything that showed any kind of improvement of symptoms, and there was all sorts of recommendations out there on how to treat a COVID positive patient. I do think in this setting, one of the things that's probably underutilized, and even underutilized by myself, has been monoclonal antibody infusions. So I just looked up prior to coming here, you are eligible to get an antibody infusion if you test positive within that first 10 days. After that, you're no longer eligible. So it's a good idea to kind of talk about it with everyone now, because it's really only for those that have mild to moderate symptoms. If your oxygen level is dropping, then you actually need to go to the hospital, and they have different treatments than the monoclonal antibodies that are actually infused on the outpatient basis. So around here, places that do it, I think the closest one is called the Infusion Center. It's on Forest Avenue, and I actually looked up on their website. You can fill out, again, it's a questionnaire. They do require that your physician, that they have the authorizing physician. So, if you're a patient of Dr. Cook or myself, we'd help you fill that out. Or your primary care provider can do that. But it is if you find out that you become positive, it's a good thing to ask for, because it's not widely utilized right now. But it is really the best way to keep people that have mild to moderate symptoms out of the hospital, out of the ICUs, and you are eligible for treatment if you have been vaccinated, because that was one of my questions, and what I had some conflicting answers as to whether or not you'd give it to somebody that is vaccinated, and the answer is yes, and it depends on those symptoms. Now, a lot of times what I've heard from the infusion centers is that they'll make an appointment for somebody, but by the time they get there, they're either feeling a lot better and they cancel the appointment, which is fine. I'd rather you have one and not need it. But they are trying to get people in very quickly for this, so that while you're symptomatic, you get it, and it makes people usually say it's a very quick turnaround. And it can significantly improve your prognosis by getting that. So if you do find out that you become positive, or even a family member of yours comes back positive and they're kind of at home, and a lot of people are not necessarily seeking much treatment because you're supposed to be quarantining, but this is a good thing to ask for. So if you find out that your family member or someone is positive, you may say, well, have you asked about that antibody infusion and where you can get it, and could your doctor prescribe it? That is a very good option, especially if you're not requiring increased oxygen, or you're not needing a hospitalization. So, and most people do, have mild to moderate symptoms and are at home. So it's a good treatment for those. Thank you.
Well, all of that's just great information. Thank you, Dr. Shear, and thank you, Ann Hopper. Ann, what's the name of your new social worker? Christina. So I just wanted to piggyback on Dr. Shear and Ann Hopper's little segment here in relation to the navigation, the safety net series, part 5. If you have that document. If you have that document handy on your coffee table that we printed out for everybody about a month ago, on page 2 of that document, 2 of 5, talks about social services. The team has hired a new social worker, and that person plans to start here in independent living in the next couple of weeks to complement Kathy Moran and her services. Kathy's been here for a very long time, and her anniversary date is coming up. But social services is a critical component to this safety net, this aging in place philosophy that I keep referring to. Social services, without question, serve as navigators for residents. And quite honestly, whether you're living in independent living or memory support, assisted living, or healthcare, those folks are your neighborhood leaders who have been, it's in their job description to serve in that capacity. In independent living, we have Christina and Kathy Moran. Social services has been and will continue to be a really critical component to navigation, especially as healthcare, not even the continuum, to complement the continuum of care and the maze of services that residents can tap into temporarily or permanently. That navigation is a difficult one, and the social services team are there to help residents navigate through that maze. As we're aging, we have a plethora of services here at Cedar Field that residents can take advantage of temporarily or permanently. And so the role of social services is sometimes really just to listen. They're there to be there for people, and or when they're taking in that information, they've been trained through the eyes of Cedar Field's policies and procedures or their own education to take in that information, synthesize that information, and then connect people, educate people about the variety of things that they might want to consider, either gently or strongly. And so their role is critical here at Cedar Field. If you have not developed a relationship with Kathy Moran, if you live in independent living, which is part of the clinic, social services is part of that wellness clinic team, I would highly encourage you to be proactive, and Kathy can take you to lunch over the next course of a year and really develop a solid relationship with your social services team. I know if I'm stranded on an island, I want a good speech pathologist, which happens to be my bride, a good nurse, and a good social services person with me if we're stranded on that island. So take advantage of what you have here at the community and develop a relationship with your very own team. You'll be better off for it. Shifting gears to human resources, I have great news. We hired an organizational development manager. Her name is Sonia Dean, and she's in orientation today. Sonia is with us to complement the human resources department with recruiting and onboarding and training and development. She has a great background. I'll provide a little bit more of a resume or Stephanie next week on the live chat, but that will help round out our human resources department, a mighty team of 3 people as we start to gear back up again with the complement and services of this team member, Sonia Dean, to build back up those FTEs that we've lost here over the summertime because of the vaccine and or just what I call as the workforce pandemic. So good news. Other good news from Human Resources, I just want to highlight a couple of people who have some work anniversaries this month. If you haven't heard the news already, Pam Watson, who works in our business office, is celebrating 25 years with our organization. Beth Premack in sales and marketing will be here 25 years on September 20th. Margot Olson, who works in housekeeping, is celebrating 25 years. Sean Patterson is celebrating 20 years. Nora Son, who works in housekeeping as well, is celebrating 10 years this month. Felicia Ahu in housekeeping is celebrating 1 year. Katrin, many of you know Katrin, needs no introduction. She's serving 1 year this month in wellness and lifestyles. And then Andy down in the Cedarfield store is celebrating 1 year. If you see these folks around the community, please congratulate them and thank them for what they have done over the course of their tenure. I do have one gossip squashing moment here. And so let's just squash this rumor right now. Please, everybody, can we all collectively squash this rumor that the pool is closed except when the workers aren't there repairing the warranty item. So there is information credible information that we have at our fingertips that visitors and residents are swimming in the pool after 6 o'clock at night. So if we can squash, that's probably actually not a rumor, it is accurate. If we can just all please keep out of the pool, it is a construction zone in that area right now as we go through that warranty fix. I know it's an inconvenience, believe me. I had heartburn even delivering the news that we've already have a warranty item on that building. And I know people want to use the pool. We do have a very active membership right now with the YMCA at Tuckahoe. And so if anybody would like to join that membership and take advantage of the pool there, we have a strong partnership. But the pool area is off limits in the evening hours. A couple other administrative updates. Don't forget the Cedarfield 25th anniversary celebration is quickly upon us. I can't believe we've been planning this, Mr. Rutger, for the last year. And this music festival is just days away. It's just weeks away. September 23rd is a team member celebration out in the front area. So a little commercial break here. I'm going to be asking anyone that routinely parks their car out front of the main building that on September 22nd, we're going to respectfully ask residents to park their car in another location because our celebration with the team members is out front on the front lawn on the 23rd between the hours of 11 and 3 o'clock. And then that evening, the dining services team has a delightful menu planned for the residents, along with the music festival and the balance of people who didn't receive the meal on Thursday night, on Friday night. So it should be a fun-filled 2 days, September 23rd and 24th. More details to come about the lineup of musicians for our music festival. Other information that you'd like to garner, please feel free to look inside of your Informer. It's got lots of information in it. On the 29th, we are having a retirement party to celebrate Beth, Margot, Trudy, and Maddie. So we are honoring those 4 people. Just a little little sidewinder here. I got a little slack last week during the live chat for not mentioning Ann Reed as retiring. I did meet with Ann. I know I'm going to contradict what Florence just said, but I did meet with Ann in the hallway, and I apologize. She says, Michael, I'm not retiring. I am planning to work. I just need to move closer to my daughter. But we do wish Ann well. Being at the concierge desk and you filtering all kinds of questions and serving as that great customer service team member, as Ann has done so faithfully over the last couple of years. We will miss her dearly and miss her presence here, especially in the evening. A couple other things for me. Cellular phone. We have contacted 2 companies and are soliciting a third to review another analysis that we did from a few years ago to see if there's any opportunity for the cellular phone company to install an antenna at this community to improve the cellular connectivity for residents and anyone really, particularly here in the main building. So we haven't lost sight of that. More details as we uncover them about that analysis. We didn't make reference to flu shots at the top of the hour. Again, we're working Remedy Pharmacy, our pharmacy strategic partner, has procured the flu vaccine, and they're trying to attain a date of when they will be shipped. Those vials will be shipped to Cedar Field. Right now, we have a couple of flu clinics scheduled for residents in the month of October. Hopefully, in the next week or so, we'll have some good news whether we are proceeding with those flu vaccine clinics right here at Cedar Field. D-Wing residents, we have scheduled a town hall meeting, Jack and I, on September 17th at 1 o'clock, right here in the Fellowship Hall. So mark your calendars for that. If any other area wishes to have a little mini town hall meeting, please feel free to contact yours truly in the admin suite. And then lastly, unless there's any other questions that have come in, another question came in earlier today about a voting precinct. Is Cedar Field proceeding to be a voting precinct? And the answer is yes, as of this very moment. There has been no indication from the Department of Health that we should cancel being a voting precinct right here in the Fellowship Hall. So as of this very second, it's our plan, our social accountability plan, to proceed with being a voting precinct here in November. And I think that is all for me. Let me just look at my list real quick. That's it. If anybody has lost their copy of this continuing care, aging in place 4-page document that we keep referring to here at the live chat, we have extra copies down in the administration suite. Feel free to stop down and retrieve an extra copy. Reverend Florence Brooks is here to celebrate some good news and some spiritual well-being.
Thank you, Michael. In 2018, Jonathan Rausch published a book entitled The Happiness Curve. And this book supported the idea that growing older makes us happier. His theory is a counterintuitive U-shaped curve, which suggests that for the very first decades of adulthood, the satisfaction for most people begins to drop, with the low point occurring around the age of 40 to 50, which he refers to as normal midlife malaise. And then he says that once we hit that point, this phenomenon begins to happen where our life satisfaction begins to, in fact, increase as we grow older. He says that this factor appears to be true in all sorts of variables: your gender, your age, your ethnicity, your income, the country from which you originate, and in spite of physical and cognitive declines. He says that social scientists can claim that they can now document that age all by itself plays a key role in one's happiness. And yet, Rausch says every story is in fact unique. He stresses his theory is a tendency and not an inevitability, noting that your mileage may vary. Regardless, the research strongly suggests that most people experience a slow motion emotional reboot as they grow older. And why is that, you might wonder? Well, there's a movement as we grow older away from competition, away from achievement and acquisition, and a turn towards gratitude, compassion, and connection. The underlying fundamentals with this are living in the present, taking each day as it comes, savoring the positive, dwelling less on the negative, accepting, not overreacting, setting realistic goals, and prioritizing the really important people and relationships in life. So I'm curious this afternoon, do you resonate with this? Maybe, maybe not. It might be a good topic for you to discuss with your friends and neighbors, even your family. I'd be curious to know what you think. Many blessings to each of you. Thank you for tuning in this afternoon.